Hi friends, I wanted to preface this by saying this video is about COVID antibodies. I know there is a lot of feelings about the vaccines, about the boosters, about COVID in general. And if this is not your thing, this is probably not the video for you. You probably want to click off now. And I just wanted to give you a warning. I am a patient that likes to see other people's experiences on YouTube when I'm about to embark on something. And I made this video because I went on YouTube to see if I could find other people's experiences about receiving the COVID antibodies and this new treatment, and I couldn't find any other patients' experiences. So I wanted to make this video, and I also want to say I'm a patient. I'm not a doctor, I am not in the medical field, I'm an autoimmune disease patient, and if you're clicking on this video to see if your side effects are normal or if this is something you should do, please, please, please keep in mind, I am just a patient. This is just my experience, and you should always talk to your doctor about any side effects you're having. If you aren't sure if they're normal or not, but you should obviously talk to your doctor. And if you are trying to make this decision, I would say consult with your doctor and ask hard questions. And if your family is a part of your medical care, consult with your family. So let's get into the video. Hi friends, welcome back. I'm Elaine and I'm living with autoimmune disease, and today is Evusheld Day. No, Evusheld, however you say it. I'm getting COVID antibodies. So for some of us with autoimmune disease that take certain medications, our response to the vaccines haven't been great. So there's a new drug on the market that is actually COVID antibodies, and it's called Evusheld. I know I'm saying that wrong, but anyway, today I am at the infusion center, not getting an infusion this time, but getting the injections, and it's 2 injections, and they put it in your butt, and then you have to wait here for like an hour. I am waiting right now for the medication to come out from the pharmacy, as we all do for every medication that we get at the infusion center, and they will administer it, and then I'll sit my time here waiting. But I couldn't find a whole lot on the internet about this from a patient's perspective, so I kind of wanted to bring you guys along so that I could like enlighten you into what my experience is with it. David's here with me. He's my supportive person, which is exciting. Last time I was here at the infusion center, he couldn't come in because of COVID protocols, but today he's here to keep me company. Yay! And for those not familiar with like an infusion center, I did a video about my Actemra infusion and I brought you guys along with me, so I'll link that down below. That was what I was talking about last time I was here. He wasn't allowed in with me, and so I've got my own little private area here like for infusion, but mine's just an injection and they're going to monitor me. So this is my little room. There's my blood pressure. They took my blood pressure and my temperature already. There's David. Say hi, David. Our window, the parking garage. And when you get IVs, your IV goes there. And don't listen to videos loudly. People don't want to hear them. And I'm in a chair. And it reclines, and I can put my feet up. And I have a table. So I got my shots. I got 1 shot in each side of my behind, but it's not really your behind, it's more your hip, like on the upper part of your waistband, sort of. Kind of like where you would get like a pain shot, like a pain medicine shot. I got 1 shot in each side, and now we have to wait an hour. So my vitals will be monitored for the hour just to make sure that my body isn't doing something it's not supposed to do. So there is a chance of an allergic reaction always, so they'll monitor that, make sure I'm okay before they send me home. The nurse did warn me that the side effects will be like anybody who got the COVID vaccine. Of course, from my vaccine, I didn't really have any side effects, so I'm not quite sure what to expect, but she said I should be tired and maybe like lethargic or whatever, get a headache. So I'm expecting those things, but I'm gonna drink a lot tonight, so hopefully keep myself hydrated. Hopefully that's the key, but I'll expect to not feel great probably the night and into tomorrow, but worth it to me. So I'll keep you guys updated and let you know how it goes. So I just had my first set of vitals done and everything was fine. My blood pressure is actually doing good and my pulse ox is okay. So I'm just hooked up to everything to make sure we're doing good. So I just had my second set of vitals done and I'm still doing good. So my blood pressure is good, my O2, my temperature, everything's fine. So that's a good thing. And I have 2 more sets of vitals. So they're taking vitals every 15 minutes for an hour after the injections. So you get 2 injections, and then for the hour following the injections, you get vitals taken every 15 minutes. They do it 4 times, and then you get to go home. And for me, that means I get Starbucks. I'm free. So we are leaving the infusion center now, and we are able to go home. My vitals and everything
clear of doors
went fine. Oh, I pushed the wrong button in the elevator. My vitals and everything were fine, and injections went fine. Didn't really even hurt. So I'll keep you guys updated about side effects. I assume I might have some tonight, so I'll let you guys know. I'm going to keep this video going so I can give you an update. We made it to Starbucks for a good patient reward. I have an Americano. David is having a oat milk pistachio latte. I'm about to take my mask off and enjoy my Americano. Got some vanilla bean scones down there, and I'm about to have some prednisone. So far I feel good. It's been about an hour. It took us about an hour to drive back to where we live, and so we're just gonna enjoy our Starbucks. It is now a week and a half later after I received my antibodies, after I filmed all my experiences and going to Starbucks, but it has been a week and a half. And I wanted to wait this time so that I could give you guys a proper conclusion of any side effects I had or what my experience was, because I didn't want to prematurely tell you like the day of or the day after and then a week later have a problem or have some kind of side effect sneak up and I finished the video and didn't let you guys know. So here's where we stand. It's been a week and a half, and I did experience an injection site reaction on one side. So like I told you, there was injections in both sides of my hip, my bottom, whatever we want to call it. One site, injection site, actually did flare up, and I got an injection site like I would get with my biologics. So if you are an autoimmune disease patient and you inject biologics, you probably know what I'm talking about, because it's not uncommon to have an injection site reaction. And actually, I get a lot of injection site reactions with all my biologics. My body just doesn't know what to do. And so, or my immune system is just feisty. And I get injection site reactions. So I did get that injection site reaction. It was itchy. I can't tell you if that was to be expected. I did email my doctor, let him know what was going on. And that itchiness and that injection site reaction, it did last for probably a week. Now, again, I don't know if that is to be expected. So if you are experiencing that, please consult your physician, because I know that my body kind of does that kind of thing anyway. The other thing I experienced was a cotton mouth. So when I was receiving the injections, the infusion nurse did tell me I was going to get any kind of side effects that I would have experienced in the first 3 injections. I did have the 2-dose series of the vaccine, and I had the booster shot. So the injections I'm talking about were the vaccines. And I did experience a cotton mouth with all 3 of those. And I did experience a cotton mouth with the antibodies, with the injections, the antibody injections. And it's just, somebody feels like they put a bunch of cotton in your mouth. I did get that when I first started methotrexate, and so that was something familiar to me. I drank some extra water. I did have a headache a couple of days later. I felt fine in like 24, 48 hours. And then I did experience a headache. So that was something I experienced. Now, I will say it's probably TMI, but it was on my cycle. And I usually get headaches during my cycle. So maybe that was just to be expected. She did say, the infusion nurse did say that headaches could be a possible side effect. So I can't tell you if it was from the injection or actually my cycle, probably TMI, but it's real life and I want to be candid with you guys, right? I will say the one remarkable side effect of all this that was confusing to me, and I do have a rheumatology appointment coming up, so I'll probably ask my doctor. The dates following these COVID antibody injections, my joint pain decreased. I have heard that the vaccines actually can cause flares in certain autoimmune disease patients. That's nothing I ever experienced with my vaccines, but there was a remarkable decrease in my joint pain following these antibodies. So I can't tell you if maybe it just gave my immune system something to think about besides attacking myself. Obviously, I'm going to tell my rheumatologist when I see him. I haven't been able to share that tidbit of information yet, but my joint pain has returned since then. It's been a week and a half, so it was kind of short-lived, but it was kind of nice to have that decrease in pain. But that is pretty much all that transpired. Thank you for watching. If you have any questions, comments, concerns, just want to talk to me, leave me a comment down below. I love talking to you all, so I would love to talk to you down in the chat. If you like this video and you are a patient like me that likes to see other people's experiences and you want to see more of my experiences like this, please give this video a thumbs up. If you haven't yet subscribed and you would like to come along on my adventure, I'd love to have you. The more friends, the more better. So please feel free to subscribe. And until my next adventure, go have yours.